are advised to put measures in place that respect the principles of social distancing and to allow work from home as much as possible. I want to continue to stress the importance of social distancing. Social distancing is a term applied to certain measures that are taken by public health to stop, slow down, or contain the spread of a highly contagious virus. I would like to speak now about the importance of talking with our children about these measures and providing reassurance. We are all adapting to changes in daily life. These changes are significant for our children. Schools and daycares have closed. The daily activities of children have changed substantially. Many children may be feeling anxious or worried. We need to support them, help them adjust to their new routines, and do our very best to help them cope. I encourage you to talk with your children about why we are all taking these measures now. We want to help prevent people from getting sick. Children learn by watching how their parents or caregivers cope in times of stress. I know people may be anxious about what is happening. Please know that these feelings are a normal reaction to what we are going through and that you are not alone. We have mental health resources available in our province for support and guidance. Visit bridgethegap.ca, gap with 2 P's, to access these services. If you need to talk or if you are experiencing a crisis, you can call the Provincial Warm Line or the Mental Health Crisis Line. We want our children to continue to play, explore, learn, have fun, and feel safe. We must also remember that social distancing applies to children as well. I ask parents not to hold playdates or sleepovers for their children. These activities make it difficult to maintain the principles of social distancing. There are many activities, however, that family and children can do even when applying social distancing from others. We can sing songs and dance, encourage active play in our own backyard, read books, and go for walks, all while respecting the principles of social distancing. While schools may be closed, daily routines such as regular bedtimes and meals are important for children and teens. Help your child stay socially connected to friends and loved ones through technology like Skype or FaceTime. I would like to now speak directly to the young and healthy people in our province. Even if you are not experiencing any symptoms, it is vitally important that we all adhere to the public health recommendations of social distancing. When you are with others, or if you must go out for essentials like groceries, please remember the importance of adhering to the 2 arm-length distance. Social distancing, however, does not mean no social contact. We need to think about socializing in a new way. Connect on social media, call your friends, use technology like Skype. We are all finding new ways to connect during this challenging time. If you are on self-isolation because you have returned from travel, while you cannot visit grocery stores or other areas where people gather, you can go outside for a walk or a hike while maintaining social distancing, as long as you have no symptoms. If you are symptomatic or become symptomatic, you must, however, stay home. A reminder for everyone that if you are feeling unwell or experiencing symptoms of COVID-19, which include fever or cough or difficulty breathing, please complete the self-assessment tool on the 811 website. Yesterday, we declared a public health emergency. We did so to ensure we could put measures in place to help protect the health of our population. I want to thank everyone for your patience, understanding, and your collective actions to help us reduce the spread of COVID-19. We all have a role to play to decrease the spread of this virus and to protect ourselves and our loved ones. Thank you. I'll open to questions.
Dr. Fitzgerald, just wondering if you can tell us about any kind of plans that may be underway to establish drive-through COVID-19 testing centers.
All the RHAs are looking at assessment and testing centers. Drive-through models have been used in other jurisdictions, and everything is under consideration at this time.
Are there any chance those might take place at schools?
So the RHAs will be involved in the planning of that, and as I'm not aware of any that are taking place in schools at this time.
I'm curious, any more updates about the 3 cases now, one confirmed and 2 presumptive?
With
mild
regard,
to their
yes,
symptoms.
still mild symptoms and doing well as far as I know.
There are a lot of people who are either just coming back from travel now, they're making their way back, or some who may have been back for a week, they're starting to feel a little bit stir crazy, and they're wondering, okay, what activities can I do, what activities can't I do? So I'm hoping I can just go down a couple of lists and you can yes, no, or maybe.
Okay.
I guess kind of a doctor, may I? So if they wanted to go out inside in their yard, do activities within their own property.
So if they're coming back from travel and they have no symptoms, okay? So if anyone has symptoms, you must stay home. So if they have no symptoms, it is still okay to go outside on your property as long as you're maintaining the principles of social distancing.
What about if they wanted to go for a ride in the car but not actually get out, just to
As long
change
as
of scenery?
they were by themselves, yes.
What if they wanted to invite people like close family over, but wanted to still keep a distance, but invite them into the house, for example?
We'd recommend that not happen. We want to reduce the spread of this as much as possible, so we wouldn't want anyone to be, we think that could be avoided for a 2-week period.
What about interacting with family who may be in the same house who didn't travel, they're healthy, and they're not isolating, they're still going out and about? What's the guideline there?
As long as the person remains asymptomatic, the evidence right now suggests the risk of spread is low. However, we still would recommend that you try to stay away as much as possible. So if you have the ability, if you're lucky enough to have your own bedroom or a bedroom that you could use, your own bathroom, obviously have your own dishes, don't share utensils, that sort of thing. Just try to separate as much as possible. If you become symptomatic, of course, that's a much more important to do.
And follow-up question comes around enforcement, because there's some people who say, wait a minute, my neighbor across the street, I know they just got back from down south, and I noticed that he went out to the grocery store today. What should they do, seeing as how there isn't any sort of enforcement mechanism in place? So
I think, we hope that people will adhere to this, understanding now that it is law and that you must stay at home. Certainly, if someone is out going for a walk in the neighborhood, that is okay to do. Going to the grocery store would not be okay. It is difficult to know what to do. People don't necessarily want to be, tattling on their neighbors and that sort of thing. But if you have concerns, certainly you can reach out to somebody, and and you may even want to just remind your neighbor distantly of that the law has changed.
Dr. Fitzgerald, is the province looking at any trial drugs? We know that in the States there's a few that are being considered, a malaria drug that seems to be taking well as a brand name drug, Plaquenil.
Okay, so treatment with these types of drugs that's out of our provincial jurisdiction. Those things happen at a federal level with recommending which should be used, and there are processes in place to avail of any medications that need arise.
In terms of the region, Labrador-Grenfell, I know that lands in both Labrador and Newfoundland. Some of the maps that are out there, Johns Hopkins University, for example, is showing the cases in Labrador. Can you speak a bit to this?
Yeah, I think that's just because of where Johns Hopkins doesn't know where those cases are. I think that's just where they put it on the map because of that's where the majority of the region is, right? Is up there.
Okay, let's go to the phone lines. I understand there's 4 reporters there. We'll take first question from whoever has a question on the phones.
Yes, hi. Marie-Isabelle Rochon from Radio Canada. Wondering, so the province has tested 684 people. Is there enough resources for testing everybody who needs to be tested? As I understand, there's a long period of wait. People call and they don't get tested right away. So what is the province doing to get more people tested?
So at the moment, everybody who needs to be tested will be tested. Public health nurses are going in to do the testing. It may take 24 hours or more to get that testing arranged at this time. And everyone, though, who needs to be tested will be tested.
Is there enough nurse and testing kits in the province?
We do have enough testing kits in the province, and certainly with regard to nurses, we do have enough.
Yeah, I'm wondering about the 3 positive cases. I didn't quite catch whether any of those have been confirmed yet.
Yes, so our first case has been confirmed.
Okay. Why is it taking apparently longer than the average time to get those results back?
So I think there is an increased volume at the National Microbiology Lab at this time. They've tested many thousands of tests, so that may explain the slightly longer time.
Okay.
Yeah, I'm wondering about ventilators in the province. Can you give exact numbers if the province is attempting to procure any more from manufacturers?
My understanding, as of last count, there was about 156 ventilators in the province, and the purchasing of ventilators and those sorts of things are outside of the shop of public health, so I'll have to refer you to someone else within the Department of Health for that, to answer that question.
So, can you say if they are trying to buy any more?
I think at this point, they're looking at their supplies and trying to decide, but I'd have to refer you to somebody else in the Department of Health to answer that question specifically.
Okay.
Hi, this is Diane Crocker from the Western Star.
Yes?
I know you did mention about the swabbing centers. You asked briefly about it. We're seeing construction actually happening out here in Corner Brook of some kind of a mobile center and civic center parking lot. Wondering if that one will be used for swabbing, and we're also hearing of using the Stephenville Dome for a swabbing station. Do you have anything on where these stations will be located?
At the moment, those plans are being developed by the Regional Health Authority, so I'd have to refer you to them to know exactly what's happening and where those are going to be.
Do you think it's necessary, though, to let the public know as soon as you can to where these things are and why they're happening? We're getting a lot of, rumors and conversations going around the community.
As soon as the regional health authorities are ready to go ahead with any type of assessment centers, I'm confident the public will know.
Okay, thank you.
Is there going to be some kind of line set up for people to report possible violations under the now public health emergency? Like we saw that first number come out, but that wasn't real. Is there going to be anything like that?
At the moment, there's no plans to have something like that.
Okay, and I've had a lot of people asking too about, when walking outdoors, places like Bowring Park, which has been very busy over the last few days with the nice weather, just walking with friends and dogs kind of in between people as a barrier. Is that okay?
So you need to make sure you can maintain 2 arms length distance between you and another person. I mean, obviously, if you're a parent who's walking with your child, you're not necessarily going to do that if you're in the same household, but if you're walking with a friend or if you're, just in a busier spot, it's a good idea to try to maintain that social distancing. We know that being outdoors is likely safer. The virus, cold air will kill the virus. However, if you were really close to somebody and there was coughing, as with any virus, there is that chance. So you'd want to maintain that social distancing.
I was wondering in the last 24 hours since we had a press conference, if we know anything new scientifically about COVID-19, like how long it can stay alive on surfaces like maybe pet hair or just your sink.
So I haven't heard anything new with regard to that, and specifically with respect to pets, I haven't heard anything new. But, the information is changing very rapidly, so, we may have more information tomorrow. You never know.
Question about 811. We've seen a lot of concerns from people about how long it's taking to get through to someone and then how long it's taking to get a call back. What are the sort of wait times right now, and what sort of backlog are we looking at?
So I think the backlog has been decreased significantly. I don't have the numbers in front of me right now, but they've added, I think, 14 more nurses as of yesterday or day before, and the wait times to get a call back have reduced significantly in that time. And there has been a great uptake of the 811 assessment tool online, and that has certainly made a difference. So we do thank people for using that.
We've seen the Newfoundland Labrador Liquor Corporation announcing that they're closing their stores this weekend to in-person visits. Was that something that was done on your recommendation? Because a lot of people are saying, well, hold on, how's that any different from a grocery store that's going to continue to operate? The risk should be fairly comparable here.
No, I think the liquor stores or the NLC decided that of their own accord. They felt that they could fulfill the orders by doing it that way.
Dr. Fitzgerald, just looking for some clarification. I know you went over when it comes to 50 plus people and these other businesses that weren't ordered to close. A lot of questions about car dealerships, hair salons, and spas, for example, because that is a close proximity dealing,
Right.
but generally it's under 50 people.
So I think right now, I mean, all of those things will come into consideration as the evolution of this outbreak changes. If we start to see community spread, then obviously we're going to be much more careful about any kind of situation where that may happen. In those situations, though, if people are able to do a brief screen to see if someone's traveled or if they've been sick. Well, if someone's traveled in the last 2 weeks, they shouldn't be going out to get their hair done. But, if there's any risk factors that they may have, if they're unwell, obviously we wouldn't recommend that you do somebody's hair if they have cold-like symptoms or flu-like symptoms. So I think there is a risk assessment, and I certainly would refer any of those groups to their professional associations to get guidance on that.
If somebody on St. Pierre-Miquelon was to become ill with COVID-19, are they coming to the province, and what is being put in place to monitor that situation?
So my understanding is that Eastern Health has an agreement and understanding with France and St. Pierre-Miquelon to be able to care for patients there who need care, whether they have COVID-19 or anything else. All the same precautions that we would put in place for anyone who presented to an acute care hospital with COVID-19 will be in place for someone from St. Pierre-Miquelon.
Let's go back to the phone line. So if any of the reporters on the phone have follow-up questions.
Yeah, I have a question. Hello?
Yes, go ahead.
Yes, okay. Would having 72 rolls of toilet paper in your house reduce your chance of contracting COVID-19?
No, I don't think toilet paper is protective in any way, other than, excuse me, it might, sorry, I have a dry spot here. It might actually help you to not have to go to the grocery store as much, I guess. Sorry, I promise I'm not infectious. It's just a dry spot in the back of my throat.
Okay. So in terms of people hoarding, can you sort of go over again what people should actually be buying? I'm sorry, are you going to be okay?
Oh yeah, go ahead.
Sorry. Okay. What people really should be focusing on when they go to a grocery store or anywhere else?
So I think, groceries and goods are still coming in as they normally would. That traffic has not been changed. So I think people need to realize, if there is a chance you might have to isolate yourself, then certainly you want to make sure you have enough to get through 2 weeks. So, produce or canned goods, packaged goods, that sort of thing. But chances are you're not going to have to be in your house for an extended period of time where you would not be able to get some groceries. So, hoarding at this point is not necessary. I think to some degree it fuels panic and hysteria, and we have to be very careful about that. We are being cautious because we want to reduce the spread of this virus, but we have to, at the same time, realize that we don't have to be alarmist about it.
Thank you.
You may have spoken to this, but these big work sites like the Muncore Science Facility, Grieg in St. Lawrence are still operating. What do you recommend there for those employees?
Well, for any employer, we recommend that they try to, or that they put in place the principles of social distancing to ensure that their workers could work safely. Depending, I understand there are some bigger work sites that are going through the process of trying to reduce their workforce so that they can allow that to happen. And certainly we commend them for doing that. We understand that, you know, many of these places still have to have a certain number of people working there to be able to maintain them and to keep them safe. So, you know, as much as possible, we would want employers to try to reduce social distancing or put measures in place to improve social distancing, sorry.
And on that, kitchens, a lot of restaurants are switching to a takeout model, but kitchens are often fairly close quarters. Are there any concerns about the staff within these facilities, even though it's a fairly small gathering, usually of people that are in there?
Well, first of all, if anyone is sick, they should not be working. So that's the one thing that you can do to keep it safe. People who work in kitchens generally tend to be very good about hand hygiene, so that's important. We recommend, of course, no tasting, which can sometimes happen in kitchens, I'm sure, and to try to, as much as possible, put measures in place to improve social distancing. So whether that's to increase table space so that people can work a little bit further apart.
I've seen some concerns about military flights. This is often people, and American military crews, for example, end up laying over here, flying across the Atlantic. So one person, for example, saying, "Okay, well, I saw them all checking in at the counter, at a hotel in town." Do they have to abide by the quarantine restrictions because they're obviously flying in from outside the country? And what measures are in place in order to make sure that there isn't that interaction then between them and the general public?
Okay, so screening still has to happen. So if there were any concerns with screening protocols, they would be addressed at that time. If people are asymptomatic, if they're not staying over long, I think it depends on the place that they're going, I guess. That would be the most important question there, where they're heading to. So, that may be, I may be able to get a more defined answer for you if you need that.
Over the last week, we've heard a lot about flattening the curve, and we have a brief window of opportunity to do so. When does that close?
Well, it very much depends on what we see in the coming days to weeks. The thing about some of these public health measures that, if we put them in place and they work, we may not see a steep rise in the curve. And so we hope that we can say then that they worked. But it's sometimes that can be difficult because you don't know for sure if those measures made the difference. But certainly what we would do is compare the rise in our curve to the rise of the curve in other places, and that would help us to know if we're making a difference or not.
Dr. Fitzgerald, now that there are more than 770 cases of COVID-19 in the country, a lot of those in Ontario, Alberta, and BC, are we going to start looking at needing to self-isolate after traveling out of province?
So those are questions that we are considering, and we reassess that risk every day. And, it's not off the table at this point, but at the moment we're not there. But as you've seen how things can change quickly in the last week, that it could change very quickly.
Is this something people should be maybe being mindful of on their own and looking to do themselves?
We would certainly encourage anyone who has traveled outside of the province, if they feel they can, to self-isolate once they get home for 2 weeks. I would encourage anyone to do that.
Question on the phone from Peter Jackson.
Yes. I want to ask whether anything that is there any advice about avoiding COVID-19 that's specific to COVID-19 that you wouldn't be advising about any other cold or flu virus? Is there anything specific about this virus that people should be conducting themselves accordingly?
At the moment, no. It appears that it's spread through droplet transmission, so through droplets that are sneezed and coughed. So we would be recommending the same precautions that we put in place for most respiratory viruses, and just to wash your hands well, make sure you maintain social distancing, those sorts of things.
I have one more from the phone.
Go ahead.
That's for me?
Yep.
Okay, yeah. I'm wondering if you're aware of, based on kind of the orders that were announced yesterday about around businesses and gatherings, if there was any fines or kind of enforcement that had to take place as of today.
Sorry. No, I didn't catch that all. I'm sorry.
Gatherings, were there any fines that have had been placed today?
Oh, no. No fines at the moment.
We've so far still only have 3 cases. Dr. Haggie, several briefings ago, talked about the fact that we have, so far, I believe around 60 people have been hospitalized because of flu, hundreds of flu cases in the province. What do you say to people who are saying, why are we taking so many precautions for a disease that have only had 3 cases when it's had way less impact on the province than the seasonal flu has?
Right, and that's a good question. This virus is new. None of us are immune to it. There's no vaccine for it. There's no treatment for it. And the number of people who get severe disease from it is higher than the flu, and the number of people who die from it is significantly higher than the flu. We want to avoid those 2 categories as much as possible, obviously. So that is why we are concerned about this, and that is why we're trying to get out ahead.
I know I asked about the province-to-province traveling. Are we looking at closing our provincial borders? I know there's been a lot of chatter online, mainly today about that, now that we're looking to close the Canadian-US border.
To the best of my knowledge, those conversations have not occurred at this point, at least not involving me, so I can't comment any further than that.
And contact tracing for now, the 1 confirmed, 2 presumptive, how is that going?
That's going well. I believe most, if not all, of the contacts have been traced and appropriate measures have been put in place.
Okay, I think
We're done?
we're good.
Okay, thanks everyone.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
I'd like for you to join with me in the usual way in extending our appreciation to Ron for coming and speaking with us today.
At the beginning, I'd like to just acknowledge the tremendous work that Dave Vardy has done through the last 7 or 8 years on this project. Dave has worked harder than anybody else, much harder than I have, on learning about this project, and I would say that David is the most knowledgeable person on Muskrat Falls on the planet. So I'd like for you to join with me in thanking him for his work for the province. So I'm going to stick to my original topic, not talk too much about the Muskrat Falls Inquiry report, except to say a few things. What Dave asked me to speak on was a short blog I did, a guest blog I did on Des Sullivan's Uncle Gnarly blog, and it was called Rate Mitigation and Other Delusions. But I want to just say a few words about the Muskrat Falls Inquiry, and I'm sure you've all followed the media reports and read all 1,100 pages of the report, so you're all fully familiar with that. I haven't done all of that, I must admit. My purpose in writing the blog and in speaking to you today was to point out that we don't have just one problem. It's not just rate mitigation. We have two big problems in this province. The focus, public attention has been on rate mitigation, and we seem to forget our fiscal crisis, except when the Auditor General issues her annual report and attempts unsuccessfully to scare us into action. Just one of those problems would be daunting. The two together create the perfect storm for Newfoundland and Labrador. And when I did the interview this morning, Terry Roberts was telling me that Andrew Coyne, who writes a column for the Globe and Mail now, has done one, which I haven't read, but it's focused on the dire straits of Newfoundland. And the argument is that the biggest problem for Canada is not Alberta. The biggest problem for Canada is Newfoundland. Only 500,000 people, but there's a lot of money involved here. So I wanted to focus first on the delusion of rate mitigation. Reasonable and stable electricity rates are important for two reasons. First of all, we have a lot of low-income families in Newfoundland, so we need to ensure that power rates are affordable for them. And we need to keep our electricity rates low, as low as possible, because if we don't, people are going to flee from the electrical system. They're going to make changes, and demand is going to go down, prices are going to have to go up, and we're just making a bad situation worse. Now, for some reason, and perhaps it was foolhardy on the part of the province, we were invited, Dave and I were invited to the joint federal-provincial press conference on rate mitigation to announce the federal contribution. And on the way in, we met a former colleague of ours, former senior public servant, who will remain unnamed, who had actually seen the details of the report. And he said to us, you're going to be, Dave and Ron, you're going to be underwhelmed. And we were. As you all know, there was really nothing substantive in the announcement. Following that, Dave and I were offered a meeting with senior public servants on the framework announced at the press conference. And that was useful, and that was several weeks ago. And since then, Dave and I have written a number of letters to the officials to ask them for additional information. They've gone silent. They will not respond to us at all. And that's been a continual theme in terms of our involvement with the project and other issues through the last number of years. So what we heard at the press conference was the potential for rejigging the financial arrangements for the project and moving it towards a traditional cost of service project, which Dave knows much more about than I. The effect of that will be to reduce the overall cost over the life of the project. That's true, but it has a perverse impact of increasing the requirements in the early years, which means the rate mitigation problem is worsened, at least in the early years. And the second thing is that they talked about monetizing revenues that might come down the road and taking that cash up front for rate mitigation. But I don't believe that there are going to be any dividends down the road. So who in their right mind would pay for a potential flow of income down the road? It's just not going to happen. The only people who would be foolish enough to do that would be the federal government. Now, in addition, the Public Utilities Board was asked to provide advice on potential rate mitigation initiatives based on what we think are low assumptions about the revenue requirements, which will have to be provided in order to pay for Muskrat Falls. The board identified a gap of $400 million between what they estimated they could raise with the initiatives they thought of in order to keep rates at 13.5 cents per kilowatt hour, which is pretty close to what we're paying now. And I want to make a number of points about that gap of $400 million. First of all, the revenues estimated by the Public Utilities Board are estimates. They're estimates only. We don't know if they're going to be accomplished or not. The bulk of the revenues will have to come from the so-called dividends, which are going to come from the project. And you've heard a lot about dividends, and Ed Martin has always been talking about these tens of billions of dollars of dividends that are going to come to us. It's all nonsense. It's important to remember that the dividends such as they are, and if they ever come about, have to come from us. They don't come out of thin air. They have to come from what we pay for electricity. So the dividends, if there are any, will come from one pocket, and then they'll be put in your other pocket on the other side of your trousers. We're no farther ahead. Oh. Technical difficulties. And in order to can you hear me now, still on the back? Yeah. So in order to create these dividends, rates are going to have to increase by 3.5% a year. That doesn't sound much every year, but if you're continuing on and on and on and on and on, you can see over, a decade, that's going to be a lot more cost of electricity. And we've been used to very stable electricity rates over the last years, and we've gotten used to that. The second thing is that they told us that the estimates for future demand of electricity have been revised downward from the very optimistic assumptions on which Muskrat Falls was based. And we've asked them for those changed estimates, and they won't give it to us. They won't even respond to our emails, which is very unfortunate. You'd think by now we'd realize that we need to get this stuff out and to have accurate information, but for some reason, even the present government, who weren't responsible for this project, will not do that. Third, it's highly unlikely that the cost estimates for the project will be in fact accurate. And I know Stan Marshall was going out saying it's going to be $12.7 billion. I just don't believe it. There are a number of court cases and arbitrations, a particularly large one with Astaldi. But the big problem is the delays in the commissioning of the project. And so we have the software issues, which you've all heard about, and the synchronous condenser, whatever that is. But we know it's important for the operation of the line, and there's no real indication as to when either of these issues are going to be resolved. In addition, we know that the first turbine hasn't worked properly, and I know for a fact that it hasn't been fixed yet. So the problem with that is interest during construction. We have to pay, including the capital costs, the interest payments on the debt that we've borrowed for this project. And that amounts to $500 million a year. So if the project is delayed another year, that has to add another $500 million to the cost of the project. So that's a big problem. The question of reliability became an issue, particularly after Dark NL, and Dave and I urged the Public Utilities Board to expand their review of Dark NL to look at post-Muskrat Falls reliability, and we were supported by Light and Power, and they agreed to do that. And they brought that in now to a further initiative to look at the reliability issues. It's clear and this is not from me, this is from the board's consultant, Liberty Consultant, who have been right all along on this. And they feel that there's going to have to be a source of power on the Avalon Peninsula. Otherwise, we're going to be facing, and this is coming from Liberty Consulting, we're going to be facing the potential loss of power, not just for days or weeks or months. The other thing is, it's good to be connected to Nova Scotia, but the problem with that is the line only has a limited amount of capacity. I think it's 300 megawatts of power. That's not going to be enough to meet our needs. And when we lose power, it's likely to be around this time of year. And it's going to be at the time when they have high consumption of power in Nova Scotia and the rest of the maritime provinces. We know that there are no agreements with Emera to provide that backup power. And so one thing that I've done is I have no confidence in the reliability of the system. So I've installed a backup generator, and I've got 2 big propane tanks, and we're good for weeks. And I'm sure Stan Marshall has a much bigger one than mine, and does his own house. Because Stan has talked about, well, you're going to have to balance cost versus reliability, but nobody's going to be prepared to lose their electricity for weeks and weeks on end. We just can't do that. People won't survive. People will die. You just can't have that. So this is going to cost, meeting reliability issues is going to cost a lot of money. And the alternatives are either refurbishing the existing thermal plant at Holyrood, and there's a proposal called out now to determine what the cost of that might be. And any estimate, we should look at that estimate with a grain of salt, that's for sure. We should know that by now. The other option is gas turbines. And I'm told that that's another $1 billion in capital costs in order to do that, to ensure reliability. Where's the money going to come from to do that? You know, we're only 500,000 people. It's going to be very tough. And we also need to remember that the backup that we need to have forever. We're always going to have that backup power, because the main consumption of electricity is really the Northeast Avalon. And there's been a lot of population inflow from the rest of the province. So the result of that is the gap that we have is far more than $400 million. And we're a long ways from finding the pot at the end of the rainbow, which will allow us to keep rates at the target rate of 13.5 cents per kilowatt hour. And we need to be honest about that, and we need to understand that. Rate mitigation is very important, as I said at the beginning, because if ratepayers have no confidence that rates are not going to double, they are going to start to abandon the use of electricity to the extent that they can. I'm told that you have people from downtown St. John's now going to places where they can go during the day in order to keep their furnaces down or turn off their thermostats. Just think what that's going to be like if electricity doubles. It's going to be very, very difficult for us. So there is a piece of good news, and that is that we've got one really big card to play, and that's the federal loan guarantee. Dave and I and others warned the federal government right at the beginning of this project that they should not go ahead with this project until it had a full regulatory review by the Public Utilities Board. And we were ignored. So the federal government is complicit in this project. But the thing is, there's something concrete behind that complicity, because they've guaranteed the loan. And if we can't pay it, then they're going to have to step up and pay it. The key thing about the loan guarantee is that it's what's called non-recourse to the province. So the project can fail, but it doesn't come back on the taxpayers of the province. And that's a very important thing. That's similar, I was thinking the other day, I've been around a long time, that one of the great things that the late John Crosby did is when before he crossed the floor and he was with Smallwood, is that the Come By Chance refinery, there was, I believe, a proposal to increase the size of the Come By Chance refinery. And previously, under the existing refinery, the province guaranteed the loan. And when they went to try to refinance to increase the size of the refinery, John Crosby and I believe Clyde Wells managed to get that provision taken out. And it turned out that of course, Come By Chance went bankrupt. And it was the largest bankruptcy in Canadian history at that point, but we weren't responsible as a province. And that's true of Muskrat Falls as well. So I don't think that the current approach to rate mitigation will work. And I think we need to think about much more radical approaches which take advantage of the federal loan guarantee. Now, I'm not suggesting that that the project go bankrupt, but I've been involved in very sensitive federal provincial negotiations and other negotiations. We have to recognize the cards that we have, and that is a very big card, because the last thing the federal government wants to see happen is to see this project go bankrupt, and perhaps also the province as well. So what I think has to happen is we have to, and Dave particularly has been developing this idea, we've got to start to convince the federal government to convert that loan guarantee into equity into the project. What we need to do is to bring them in as the co-owners of the project. And that was the way that the Lower Churchill was supposed to be developed. There was a Lower Churchill Development Corporation established, 51% province, 49% federal government. And that legislation is still on the books, but it wasn't used, unfortunately, for this project. So whether it's all the debt or a portion of it, has got to be converted by the federal government into equity into the project. Because, let's face it, folks, we cannot afford to pay for that project. We can't afford to pay the kinds of rates that would be required in order to accomplish that. But the unfortunate thing about all of this is that we've borrowed, again, outside for the project costs, but the province has borrowed almost $4 billion for our, quotes, equity into the project. And we're going to lose that equity. We're not going to be able to pay for it. There's not going to be dividends sufficient from the project in order to pay that debt off. What means that we can't get out of that debt. That debt is going to be part of the obligations that we as taxpayers have. It was meant to be paid for by dividends from the project, but these dividends are illusory. They will never happen. So, as I said, we have, how am I doing for time, Dave? Good? 15 minutes. So, I want to, as I said, there's one part, one delusion is rate mitigation. The next delusion is how we see our fiscal situation. And what I most despair about is that the people who should know better, and I think particularly of like the university administration, they seem to be blind to our fiscal situation, even when our Auditor General gives a report and tells us that our level of expenditure is unsustainable, and in her own diplomatic way tells us that a return to surplus in a few years is yet another fantasy. So a few tidbits from her most recent report. Most of you probably know this, but I'll just go through them quickly. Our net debt is $15.4 billion. Think of that, the highest in our history. Our net debt per capita is almost $30,000 per person, so each of us here has $30,000 in debt. Our net debt as a percentage of our gross domestic product is 46.3%. It's almost 50%. Significantly higher than the provincial average of less than 25%. So we're double. That's just incredible. We've had a 33% increase in expenditures over the last 10 years, but our revenues have gone down by 9%. Just listen to this. We have the highest per capita revenues in the country, but of course our expenditures are the highest as well. So we're dreaming if we think we're going to get equalization anytime soon, because we're a long ways from that. Our problem is that we haven't properly managed our revenues. And we have the highest tax rates in the country. And I noticed there was a conference on our economic prospects a couple of weeks ago, and a professor in the political science department made a comment that we had lots of tax room in this province. And it's just not there. It's not true. We can't. We are a very low income province by and large. So the Auditor General said that in order to produce, the target is to have a balanced budget in 2023. It's an absolute fantasy, because we would have to increase our expenditures by almost 2% a year, and that's a lot of money. And what are the chances of us doing that when we've increased expenditures by 1.3% a year over the past 4 years? They're slim to none. And even with all that, we see announcements of new programs every day in this province. I mean, it's just absolutely absurd. For example, it's been reported that God love them, NAPE has negotiated a 4% increase in their salaries. So if you look at, and everybody else is going to get that 4%, and of course you've got the doctors out there, I mean, they're going to extract as much as they can from us, and that's another issue. And in addition, a couple of weeks ago, and Kevin, don't tell your brother that I said this, But we've announced that we're going to be preparing a bid for the 2015 Canada Summer Games. We've got to focus on our needs, not our wants, over the next couple of years. We're facing a very, very difficult period. And just now turning to the report of the Parliamentary Budget Office. And it won't surprise you to hear that they've confirmed that we are a basket case. We are just behind Manitoba and Saskatchewan in terms of our fiscal sustainability and require a lot of decreases in public expenditure to make us whole. And I happen to know as a fact because I actually talked to the author of the first report on sustainability several years ago, and I said, well, did you consider the impact of Muskrat Falls? Well, no. So it's even without Muskrat Falls, we're in a very difficult situation. And one of the key drivers in all this, which we share with other provinces, but we're at the beginning of all this, is our demographics. So we're the oldest population in Canada. And as George Tilley would know, that imposes tremendous costs on our healthcare system. So far I've avoided imposing any costs on the healthcare system except for being born here. I've only been in the hospital once. But that's probably about to change unless I can. I always tell my wife my objective is to die of a massive stroke on the tennis court. But I don't know if I will accomplish that or not. So, in addition, the other indications are very poor too in terms of our economy. So, the reason why we've increased spending so much is oil and gas. And of course, but oil and gas is both a blessing and a curse because we have spent the revenues we've got from oil and gas on the basis that oil prices are going to be over $100 a barrel and it's going to continue forever. So we ratcheted our expenditures up. And someone, I can't remember who, I think it was the APEC did a little analysis. And if we had increased our level of expenditures at the same average as the maritime provinces, guess what? We'd have a $10 billion heritage fund in the province. But we've got nothing to show for it. Now, I recognize there are a lot of needs and demands in the province. There's no question about that. And but, folks, we've got to start to control our expenditure, or we're done for. So at a certain point, we're going to see, and probably the only reason why we have the credit rating that we have is because we're a province in Canada, and Canada is the highest credit rating in the world, and we're a very small part of that. But they're looking at us all the time, and they're concerned about us. And the problem is, as our credit rating goes down, our interest rates are going to go up. And at a certain point, they will go below the point where they are creditworthy for major investors. They'll become what's called junk bonds. And then there's the issue of, first of all, can we borrow? And at what rates of interest can we borrow? So it's a big, big problem. In terms of the future economy of the province, I want to make just a couple of points. One is that oil and gas, our next developments are going to be in very deep water, they're very far offshore, they're going to be very expensive to develop. And I believe that the royalties that we get from that are going to be quite low. And as an aside, we should not be in the oil business. We should get out of that. It's tremendously risky. We should take our Alberta is not in the oil business. They take their revenues from the royalties, and that's what we should be doing. The other thing about oil and gas is because of climate change, there's tremendous pressure to reduce the use of fossil fuels. Two ideas that I have as to what we might be able to do. And the first of these is that we need to get our House of Assembly involved in this, and we are in a minority position. What we should do is we should appoint multi-party select committee of the House of Assembly to look at rate mitigation and to go around the province to seek expert advice and to provide a report. We need to make rate mitigation a non-partisan issue. That's what we need to do. That's the first thing we need to do. The second important thing that we need to do is we need to do what Alberta's done. And when the new government of Alberta came in, they established a task force of eminent citizens. It was actually headed by Janice McKinnon, who was a former Minister of Finance under the Romano NDP government many years ago. She's still very active. Because the thing that we need to do is we need to convince people that we have a problem. Because we're going to have to make very, very hard decisions here, and they're going to need to be made as much as possible on a nonpartisan basis. I'm just reading a recent book on appeasement before the Second World War. And of course there, when they had a war cabinet, they brought in the Labour Party into their war cabinet, and they had a national government. And it may well come to that in Newfoundland, that we need to do that. And thank you very much.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Hey, did you know?
More than 4,500 Canadians are waiting for an organ transplant right now.
Right now. 4,500.
People are dying.
And you could save a life. 90% of Canadians say they're willing to donate their organs.
But only a few are registered.
So what are you waiting for? Get registered.
It's easy and it's free.
Leave a legacy. Be a hero.
Save a life.
Find out how to register today. Go to kidney.ca.
The lift wasn't working and he was in pain, so I tried to lift him on my own. Yes, it's bad. I'll need help.
Can I help you with that?
No, I'm good.